Across the country, there is a shortage of amoxicillin, an antibiotic used for a range of bacterial infections, mostly in children. The FDA recognized the issue last month. It only affects the liquid version of the drug, which is a household staple for treating ear infections and strep in kids.
According to the American Academy of Pediatrics, the shortage is expected to last several months. They suggest doctors prescribe other versions of the drug, like the tablets or the capsules, and then crush them up into food for younger kids to ingest. Joining us now to discuss this is the president and co-founder of the Center for Medicine in the Public Interest and former FDA Associate Commissioner Peter Pitts. Peter Pitts, thank you so much for joining us.
Oh, my pleasure. Thanks very much. Important topic.
Yes, very much so. I'm seeing a lot of concern from parents of young kids for how to deal with this, not being able to get it. What is the reason for the shortage?
It's quite simple. The active pharmaceutical ingredient for amoxicillin is in short supply, and 80% of that supply comes from China. So the story really is how to secure our supply lines for pharmaceutical products. So it really is an issue of kind of healthcare, national security, and how can we move beyond single sourcing to countries that can cause shortages.
And is the reason China has not been able to manufacture or ship us enough of that ingredient, is that pandemic related? Is that what's going on there? Is it malicious, deliberate? What's going on?
Well, right now it's because, I believe, of COVID. Obviously, they've had numerous lockdowns. It's in the news these days where they have a failed zero COVID policy. So when people can't get to their jobs, you can't produce product, and we can't produce product, that causes shortages. Of course, there's also the other issue of politics, and if China wanted to, it really could severely impact our ability to access important healthcare products. We saw what happened with baby formula. This is just as insidious.
Yeah, I was going to bring up the baby formula example precisely because in that instance, there were some red flags that people said, well, you should have been able to predict this, right? Not only had there been the whistleblower who flagged, violations at the factory prior to it closing down, it is not an unknown known that we're not manufacturing this stuff at home. We're now 2 years plus into a pandemic, and it seems very frustrating to keep coming up with against these issues. We saw that with the monkeypox vaccine as well. It seemed to be an administrative choice not to pay to maintain our stores of the vaccine, rather than an inability to manufacture these things at home or have the kind of regulatory upkeep that would prevent disasters like what happened at the Abbott labs and the baby formula from having happened. Are there parallels to what's going on here? Should we have anticipated this and done more to manufacture more amoxicillin, liquid amoxicillin here at home, or at least in countries that are closer and perhaps with whom we have a less politically fraught relationship?
Well, you're right. These are known knowns. And also, just in the recent past, we had a significant shortage of contrast agents. So people couldn't get MRIs and CT scans because those agents are made almost exclusively in Shanghai. And when Shanghai locked down again for COVID, we had a significant shortage here at home. We know this. The bad news is when the FDA was asked, which products are most at risk because of outsourcing from China, the answer was they didn't know. And that's not acceptable. Similarly with baby formula, the FDA needs to have a better handle on supply chain issues, which really hasn't been a focus of the FDA to date, but it's got to be. Drug shortages and supply chain are linked at the hip. You can't have one without the other. And it's not just a question of China, it's a question of being smart and making sure that we can have more sourcing in countries that are friendlier to us, whether that's Canada or places like Israel, the United Arab Emirates, the Abraham Accord countries are friend sourcing opportunities. It doesn't have to be on our home shores. The problem with programs like those called for by Senator Rubio to make these products here domestically is it sounds good, it's a good political talking point, but financially it doesn't make sense. The reason that these products are not manufactured here at home is that there's no margin. You can produce them overseas less expensively, but that doesn't mean exclusively using China as our backyard. We've got to move these facilities to countries that are more friendly to us, that are more responsible. And again, it's like anything else. You need to make sure that your supply source is spread out, of course, across a couple of countries. Having all your eggs in one basket, and that basket being China, simply isn't a smart move.
Yeah, I think there's a lot of wisdom in that. We talk a lot about that on the show, how to counteract being too reliant on offshored labor or production or manufacturing. I think there's a desire among some policymakers here, Marco Rubio being one of them, to do more domestic manufacturing. But my guess is that would take so much changing of various regulations, labor laws, et cetera, that I don't imagine there's the appetite to do here. And so there needs to be some kind of middle ground along the lines of just what you had laid out just there.
And also, the first step here is to identify which products are most at risk. It doesn't seem to me to be a rocket science move to ask the FDA and other relevant government agencies to identify the 20 top products that are most at risk because they're being manufactured overseas. And if we don't do that, we're not going to fix the problem, because if you can't measure it, then it doesn't count. We have to know where to look so we can start fixing the problem.
In the short term, is it the case that amoxicillin, obviously a very important drug, are there similar related antibacterial antibiotics that can also cover the vast majority of the kinds of illnesses, strep, et cetera, that are being used for right now by amoxicillin? Obviously, that maybe not a long-term solution because you don't want to impact the supply of that drug as well. But in the short term, are there substitutes, something else?
Well, the good news about amoxicillin is there doesn't seem to be shortages of the non-liquid format. I remember when my kids were going through these phases, obviously it's easier just to pour it on a spoon and put it in their mouth. It tastes like bubble gum. Kids love it. There are alternatives. But this is also a teaching moment to make sure that antibiotics are not inappropriately prescribed. 30% of all the antibiotics prescribed in this country are prescribed inappropriately. And that can lead to issues such as antibiotic resistance, which is an incredibly important public health issue. So as we're talking about amoxicillin, it's also a teaching moment to make sure parents understand that antibiotics are not always the answer.
I mean, it does seem like this is a significant national safety issue. It feels really odd to have so much focus go just purely to, and not to draw you into a conversation about kind of our military adventurism, but we have such an enormous military budget. There's obviously a lot of words that are spent about how to protect the American interests with guns and weapons, but to have these incredible vulnerabilities that have been laid bare by the COVID crisis, I mean, what do you see as coming out of this? Is there any responsiveness from your perspective from the government? Is there an awareness that we have made ourselves vulnerable in these ways? Because I gotta say, this is like the third or fourth instance of there being maybe more, between not having the respirators, not having the PPE during COVID, on and on and on. Are things changing from your perspective?
I think that some people are beginning to become aware of it. Obviously, the people in my field have been aware of it for a long time. And more needs to be done. You can't deal with shortages on an ad hoc basis. And we continue to do that. And it's only going to be a matter of time before we have 2 or 3 or 4 shortages at the same time in different areas of medicine. And we're going to be in a very tough place. And people are going to start yelling, why haven't we done something about this sooner? Well, shame on us if we don't start thinking about it right now. And again, the answer isn't making the stuff here at home. That simply isn't going to happen. It's looking for other countries to help us decrease our reliance on places like China. And again, whether you have Israel, you have the United Arab Emirates, you have places like Morocco, signees of the Abraham Accords, who are more than welcome to and willing to step forward to start building facilities if they know they've got a market, and we are a big market. And if we can make them know that we will buy their product, we can solve our problem. This isn't going to be solved from one day to the next. It's a long-term proposition. These factories take a long time to build. And unless we start thinking about that right now, we're digging our own grave here, not to mix metaphors.
Fascinating and terrifying. Thank you so much for elucidating us on those subjects. Yeah, bacteria-resistant antibiotics was something I was probably the most alarmed about until COVID came along, and then we had to worry about research and all those things as well. But Peter Pitts, thank you for joining us. Can't thank you enough.
My pleasure. Thanks very much.
We'll have more Rising right after this. Stay with us.